Okay, so hi, Mr. Schaefer.
How you doing, Jill?
I'm good. How are you?
Good.
So, if you could you please tell us a little bit about yourself and maybe how the pandemic has affected you and your family?
Yeah, I'm a stay-at-home dad for the most part, and I guess the personally from a work perspective, I guess my goal was to head back to work after my youngest daughter got her driver's license, which happened last October. So I actually started looking for work in January, and then stopped probably, stopped looking mid-March and haven't really looked since. So from a work perspective, I kind of had to put the back to work thing on pause for a little bit. And then just like everybody else, the stay at home thing, the lack of, going out to eat and doing those social things, that's really been one of the biggest impacts on us.
So, you guys, I understand I'm friends with your daughter, Caroline, and I understand that I know Caroline came down with COVID, and I think you did as well.
Right.
So, do you know how long ago that happened and how long that lasted for?
Yeah. So it was my older daughter was in a study abroad program and came back March 13th. I picked her up at the airport on March 13th. Came home. We quarantined her in a room. We were going to keep her there for 2 weeks. She came down with symptoms shortly thereafter. Back pain, some chills, a slight fever. And then I started getting sick. I think it was St. Patrick's Day, the 17th. And same kind of symptoms. It was, for me, it was, a bit of a sore throat, slight fever, some chills. And then I was sick had those symptoms for about 4 days. And the only difference between my older daughter and myself was that for, I would say, 2 to 3 weeks afterwards, I couldn't concentrate. Like I couldn't read a book. I was in some training for a volunteer thing I'm doing, and I couldn't really focus on the training. So that was really the only difference between, my symptoms and my daughter's symptoms. Now, my younger daughter, Caroline, who has, tested positive for the antibodies, we look back and we think the only symptom she had was that she was just tired. She slept a lot right around that same time frame, but she didn't exhibit any fever or chills or anything like that.
Do you have any idea of maybe like why you guys experience different symptoms?
It's interesting. No, and it's one of these things. I think back in March when it happened. The thinking was, okay, for over a certain age, could be cholesterol, could be pre-existing conditions, things like that. So I don't know, why there is a difference, and it's pretty amazing that even now we don't really know a whole lot about why it affects one person one way and another way.
After you found out that you had COVID, who did you contact immediately, or like how far back did those contacts go? Did you contact anyone?
I didn't, because we were not, like I said, I wasn't working, and my wife works from home most days as well. So we were pretty much socially isolated before that period. And I'm trying to think, like, even when I picked up Chloe from the airport, I may have gone to like the grocery store once. But I think at that point, people were, I don't think masks, there was a few people wearing masks, but it wasn't kind of a thing yet, but people were socially distancing. So they were aware of, I'm trying to think. I think I went to Trader Joe's in town, and you had to wait outside in the line, and they only let a certain number of people into the store. So I didn't, reach out and contact people. I mean, I told my family and things, obviously. But we did we got tested right away. So I had symptoms the night of the 17th. My older daughter and I went on the 18th and got tested. And it was odd because I'm thinking, here we are, we're going to wait 2 hours in a long line of cars. And there's no one there. We were in and out fairly quickly. I guess I got a call. It was when they were announcing, I know our town was announcing on Instagram, another case. So I got a call from, I didn't get my results back for like 2 weeks. My daughter got hers back in like a week. Mine were 2 weeks. And then you got a call from someone who was doing contact tracing. And then they asked all the questions. Where were you? Who did you come in contact with? Things of that nature.
So you kind of touched upon like the whole testing process, and
Mhm.
I guess for you guys it wasn't as long of a process as it is for some other people. But
Mhm.
could you maybe go into depth a little bit more about like what the actual process of like testing was like?
Sure. We went over to it was like an urgent care facility, a couple towns over. We drove over, and they had it's interesting. They had a tent set up out in the parking lot, and they were having issues with, I think they had some kind of propane heater or something because it was still kind of cold at the time that was malfunctioning. So that was probably our longest delay. So we had to go in. We went inside, registered. They took our phone numbers down. We went back out to our cars, and they said they would call us. So they were having a problem with the tent. So then they moved testing inside. And we almost resembled like a hospital emergency room. They had little rooms, and that's where we got tested. So my daughter and I sat in the car. They called us on the phone. We went in one at a time back into the building, and then we did the nasal swab, and then we were home. So if they didn't have the issue with the tent, we would have been in and out of there in like a half an hour, which was surprising. And there was nobody around. Right? I expect to see lots and lots of people. There was maybe 10 other cars in the parking lot, and nobody. I'm trying to think, like nobody even online as we went in to register ourselves. We walked in, there was nobody there. There was actually more nurses and security people than there were people being tested at the time.
So within like the time frame of the pandemic that's been going on, when running around was that? Was that when we were peaking, or was that a little bit before? Or?
Right before, I think, because I remember my daughter, like, they were still announcing, the mayor was announcing on Instagram, 20-year-old female positive with COVID. And then by the time my results came back 2 weeks later, so many people were being positive. It was just, 5 more, 6 more, 7 more. They couldn't do the individual thing. So it was probably, 2 or 3 weeks before we started to really go up.
So when it comes to, you talked a little bit how your daughter had to be kind of confined inside the house.
Mhm.
So you had it, your 2 younger daughters had it. How did you guys manage during quarantine? Like, were you each in one room, or did you kind of just...
Yeah, we're lucky enough that they both have their own bedrooms. So when she came back from Europe, we were all kind of isolating at the time. Like I said, she was up in her room. We brought her food up to her room. Like, she did not come out of her room for 10 days, 2 weeks, I think. So we really isolated her. Then I started coming down with symptoms. So then I isolated myself, and then my wife was bringing us both food. And then even after we both got better, we still kind of maintained this, as best you can, right, in the house, maintained this social distance somewhat.
Did your wife not get COVID?
She went with my younger daughter to get tested, do the antibody testing, and my younger daughters came back positive, and my wife's came back negative. So we're not sure if it's a faulty test, if she doesn't have it. So she said she's going to go back and get tested again.
Wow, that's kind of
So it's I'm doing the shopping and
right
things like that. But it's just it's a really weird thing because it's I think it's so contagious that it's surprising that she didn't get it.
So while you guys were quarantined inside the house, or I mean, each of you, I guess
Hmm.
you guys weren't all at the same time, each like confined to a room. It was like
Right.
your oldest first, and then so I can imagine that it would probably feel lonely being like confined for that long, especially like for you. You were talking earlier about how you're a stay-at-home dad, and then you kind of had to stay isolated, and now you have to be like extra isolated because you
Yeah.
have Corona. So, could you talk a little bit about the feelings that you went through while you were in that type of isolation?
Sure. I can speak to, my older daughter. So she was, study abroad program. It got ended early. So we hadn't seen her in, you know, more over 3 months. So it was like, it was really odd. Welcome home. Like I remember meeting her at the airport and, very careful at the airport, stayed away from people, saw her come off the plane, gave her a quick hug and a kiss, grabbed her luggage. And then we were outside almost immediately. And having not seen her in such a long time, then boom, she's in her room and we don't see her again. It was just odd, right? So there wasn't like this. We spoke to her while she was overseas, obviously, but it was like no catching up or anything like that. It was okay. Now you got to stay in your room for 2 weeks. So that was odd. And then then when it's my turn, it's when you start, it's like, you have the flu, you have this 48-hour bug and you just sleep the whole time. You're in your room and that's okay. This was just a bit different because my symptoms were fairly mild other than not being able to concentrate. So I think I watched a lot of TV, just like flipping around the channels. That was really all I did for, almost a week, I think. But I probably stayed isolated in my room for about a week, 10 days. And then again, we were just kind of, moving about the house.
So, what were the treatments that were involved, or did you take any treatments, or did it kind of go away on its own?
No, I didn't really. I mean, I took just like Advil because I didn't really, you know, like I said, it was a slight fever. Like I've had, like the flu where it's way worse. So my symptoms in terms of being sick was not, it really wasn't too bad. So it was just, some Advil. I tried to drink a lot of water. I still had an appetite, so I could eat. So, but yeah, it was probably just Advil.
I think it's interesting that you bring up the flu because, like, I know when we started learning about coronavirus, like, some people were saying, "Oh, the flu is much worse," or "COVID is much worse," and
Right.
like
Right.
the difference in symptoms. It's interesting how like everyone is kind of experiencing something different.
Yeah, it was for me, I guess my concern when I got it was, all right, I'm older. Am I going to experience respiratory issues? And I really didn't. And like I said, it was more mild, but you wonder, like the concentration thing, is makes you think like, what does this thing do to your body? So we definitely know that, it's different than the flu, obviously. But it was a weird thing. Like my expectation, I think when I started to kind of get chills and things was, okay, here we go. It's going to feel like the flu and I'm going to be sick as a dog for like 48 hours. And it really wasn't. I mean, I had some chills and sweats and things, but yeah, my expectation was that it was going to make me feel a lot worse.
I would think that the one thing with Corona though is that there is a lot of uncertainties, like we were kind of talking about
Yeah.
what might happen. So, what kind of gave you, I guess, the strength to kind of keep getting through it because you were quarantined for so long, you and your family?
I think seeing my daughter, get better, and then we almost mimicked each other's symptoms. We also had she had like back pain. Like I remember walking in and bringing her food, and she was like laying over this chair. I'm like, why are you laying that way? Oh, my back is killing me. And about a week later, same thing. Like I had just a real bad backache. So I think I was kind of assuming that I'm gonna see the same symptoms that that she did. But I was concerned, I think, and a little anxious about, whether or not, based on my age, it would be it would be different.
So for those who may be suffering from COVID now, who are maybe around your age and are facing those uncertainties, is there anything that like any type of advice you would give them? Oh, this is how you could, stay busy or stay motivated. And is there any type of that advice that you could give?
Well, I think, for us, we kind of stayed busy just, doing things around the house. We found a puzzle and then we did a puzzle. And I mean, I probably hadn't done a puzzle in 25 years. We played, games out in the backyard, some games on, some internet games, some trivia games, things like that. My oldest likes to cook, so we did a lot of cooking together. We've probably, in the last 3 months, have eaten more meals, obviously at home, than we have in a long time. We'd like to go out to dinner and, things like that. So it was kind of a nice time in terms of hanging out with the kids, because generally, even though they're both, my oldest is off at school, but summertime she's here. You don't see them, right? They're home, they pop down, boom, and they're off seeing this friend or that friend, they're going here or there. So from that perspective, it was kind of nice just to kind of have that family time and just do, find things to do, different things to do that we wouldn't normally do if we weren't confined to our home. So I guess I would just say, make the most of it with your family. If you have kids, the age that my kids are at, just find things to do with them. And, we've had a lot of laughs and a lot of weird stuff. I had, like my youngest gave me 2 haircuts. She gave me a mohawk at one point, cause we weren't going out anywhere. She dyed my hair once, or tried to dye my hair once. So yeah, we just did whatever, just tried to make the best of it.
Yeah, I think being like quarantined with your family, it's either you guys get much closer or you guys can't stand each other by the end.
Yeah. I always, we have neighbors, and like, I don't know what advice I would give to parents who have young kids. Like, we have neighbors with these young kids, and like I hear, the kids over there, and I always think like, oh, thank God my kids are older, because if you had young kids, like I'm sure it's difficult. Like, I remember when they were younger, just coming back from work and, playing and running around and doing this, that, and the other thing. And it's exhausting. So I couldn't imagine now if you were, home, had a job, and you had young kids. That's a tough thing, I think.
Yeah, definitely. I mean, I can imagine. So when it comes to your experience with COVID, and you kind of see like the country started, I would say that they have been reopening like relatively quickly, especially compared to like the state that we're in right now,
Right.
in comparison to like other countries. So is there anything that you would like to see different in our country or in our healthcare system based on your own experience?
No, I don't think so. I think, there's from my perspective, an obvious lack of leadership from the top, from a national message, right? We're kind of doing things state by state. So it would be nice if we just had leadership from the top. In New Jersey, I think, we're doing what we can. We've been out to dinner outside, so we went out once or twice. I think they're doing the right thing. I don't think it's smart to be inside yet. I think it's okay to be outside. We're going to the beach middle of August, and one of my concerns is being on the beach, right? How close will people be? Things like that. So I think we're doing the best we can at certainly the state level with the information that we have, and trying to learn. I mean, I think based on where we were, a couple months ago with hospitalizations and things, and where we are now, I think it's we're doing something right.
Yeah, I definitely agree. I think that, I mean, in other states, they're definitely things that could be handled differently, especially if I know there's been like pushback on wearing masks and
Yeah,
everything.
yeah. Well, I think it's interesting, right? That they didn't, if you were, and you can ignore the politics of it for the moment, but if you were a state, Colorado or out that way, and you saw New York, you would think that here it comes. Like, this is going to happen to us in a month or 2 months, 3 months. I mean, it may not be as severe, but it's going to get bad. Just based on the travel numbers, right? You can look at like, all right, why did it start in New York and New Jersey? And it's, you either commuted into the city, and you have a lot of bedroom communities here, or you have major European travel hubs, right? So it makes sense that it started in New York and California. And it was kind of ignorant to think that it wasn't going to come and spread to your state, right? Regardless of you're a red state or a blue state, right? And I remember right before I got sick. So masks, like I said, masks weren't a thing. And I think I was of the impression that I don't buy it, that a mask is even going to help. And then as we learn more and more and more, and okay, the masks are going to help, not you, right, but protect somebody else. Great, well, I'll wear a mask. So, go to ShopRite or wherever, I'm happy to wear the mask. And then, when you're home here, you don't have to wear it.
So I was also curious, we've talked a lot about or we've seen a lot about how people are talking about getting corona, you're immune to it after you get over it.
Yeah.
So I was wondering if you and your family, how much of the safety precautions you're still taking, or if you guys feel like, oh, we're safe now since, or how what your thoughts are on that.
Yeah, it's an interesting thing. I had a friend who said to me, do you feel like a superhero? And I'm like, no, I don't. No, I wouldn't use this word superhero. My behavior is different. So when I go to like ShopRite, I'm not concerned at all because I've had it already. And I think if I hadn't had it, I'm not sure what we would be doing. I'd be really nervous about going anywhere, I think. So having it early and then getting over it, I think for me, and I think pretty much for all of us, has changed our behaviors. We're a little less cautious when we do stuff. Now we're still doing social distancing. So my mother-in-law, we'll go visit her. We haven't been in her house. We'll sit outside with her, socially distanced. So we'll interact with her as if we didn't already have it. And again, my wife is going under the assumption that she hasn't had it. So we're still kind of following those things. But it has changed the way we think about it. Now, the only other issue with, getting it in March is, okay, now you're immune, but like the flu, for how long, right? So I guess my thinking is, do I start to get nervous again in October? Like, I don't know.
So based on your experience, if you could rename COVID-19, what would you call it from your perspective?
I don't know. I saw that question, and I don't know that I would rename it anything. I think, it's got a medical type name. To me, it sounds serious, right? I know other names have been bandied about, but yeah, I wouldn't, maybe, looking back on, how we got to the point we're at right now from just a political universe, maybe a more dangerous sounding name would get people to be, I better put a mask on, or I better take this thing seriously. But yeah, I don't know that I would think of another name.
I also want to go back to talking about the antibody testing for a minute. So did all of you guys who had corona get antibody testing, and what was that experience like?
We did not. I don't think my older daughter did. Just my younger daughter and my wife did, and they were back pretty quickly as well. So it wasn't, I think they went to the same facility that we did. And it was relatively painless from a weight perspective, and what they had to do. I think they did a blood thing.
So kind of like to wrap up the interview, what advice would you give to the students who might be watching this type of interview, especially the students who maybe will have to stay at home for their fall semester and be quarantined, kind of like how you were?
I think, you think of all these things, right? The impact on, it's almost like everywhere you're looking, especially young kids, right? Proms and graduations and school, and if I was a graduating senior, do I go to school? Is it worth the money? Do I take a gap year? How am I going to find a job? I get it. There's a lot of anxiety and things. I guess my only comment there would be, it's really not that bad. If you think about, living in a war zone or something where, you have a chance of someone dropping a bomb on you or something blowing up. We're not there, right? So there's certainly worse things. I always think of like, World War II, like living in like Paris or London, where planes are flying over every night, dropping bombs. It's not that. So it's bad, but it's not, end of the world bad. And I think it's just, you have to, we'll get through this eventually. And we always do, I think, as a country, and we'll figure it out.
I think it's interesting you bring up the point about the war zone, because I actually talked to my grandfather about that too, about how people were comparing the pandemic. They're like, "Oh, it's like a war zone out there or whatever," but it's nothing.
No, yeah, and it's a generational thing, right? So I think, I think my generation and then yours as well. We're really like the first generations that haven't really experienced any kind of war. Obviously, I mean, if you're in the military and you're going over, but so we don't really, I can speak for myself. You don't really understand what it's like to be, to use those kinds of phrases, right? A war zone or things like that. So, that's kind of, as you sit around, you get a little lonely and you get a little, when is this thing going to be over? You just kind of think of that. Like it could be, it could be a lot worse.
Definitely. So thank you. I think that wraps up our interview. It was great having you. You gave us some really great answers. And really excited to see this up on our website. So thank you.
You're very welcome.
Okay, I will finish.